Have you heard about Berberine? It's one of the most talked about supplements right now, but if you're on prescription medication, there are some really important things you need to know before trying it. Before we dive in, just a quick note. This video is for general information only and is not a substitute for professional medical advice. Always speak to your GP or pharmacist before making any changes to your medicines or supplements. So, what is berberine? It's a natural compound extracted from plants like barberry and golden seal. It's been used in traditional medicine for centuries, and today it's widely available in the UK. But here's something important. In the UK, it's sold as a food supplement regulated by the Food Standards Agency, not a licensed medicine approved by the MHRA. That means it hasn't gone through the same rigorous approval process as prescription drugs. And that really matters if you're already taking medication. So how does berberine work in the body? Research suggests it activates something called AMPK, sometimes described as the body's metabolic master switch, which may influence how cells process glucose and fats. But the reason it raises clinical concern is what it does to liver enzymes. Berberine appears to affect a group of enzymes, particularly CYP3A4, CYP2D6 and CYP2C9 that your body uses to break down many prescription medicines. It may also affect a protein called P-glycoprotein, which helps transport drugs out of cells. When these pathways are disrupted, the levels of certain medications in your bloodstream can change, meaning either reduced effectiveness or an increased risk of side effects. Let's look at the specific interactions that concern healthcare professionals. If you're taking medication for type 2 diabetes, particularly insulin or sulfonylureas, berberine may enhance their blood glucose lowering effects. That sounds positive, but it can actually increase your risk of hypoglycemia, where your blood sugar drops dangerously low. That needs careful management with your doctor. If you're on anticoagulants like warfarin or one of the newer direct oral anticoagulants, DOACs, berberine may interfere with how those drugs work. For warfarin users, this could mean your INR needs more frequent monitoring. Your anticoagulation team or GP would need to be involved before you consider taking berberine. Berberine may also increase blood levels of statins and immunosuppressants, drugs that are prescribed at carefully calculated doses. If those levels rise unexpectedly, the risk of toxicity increases. This is especially relevant for anyone who has had an organ transplant or requires immunosuppressive therapy. So what should you do with all of this? The most important step is to speak to your GP or pharmacist first, especially if you're on any prescription medication. Do not start, stop, or combine supplements with prescription medicines without medical advice. And this also applies if you have liver or kidney disease, if you're pregnant, or if you're breastfeeding. If you have planned surgery coming up, current guidance suggests stopping berberine at least 2 weeks beforehand. And if you experience any unexpected symptoms while taking it alongside medication, you can report this through the MHRA Yellow Card scheme, the UK's official system for reporting suspected side effects from medicines and supplements. To recap, berberine is an FSA-regulated food supplement, not an MHRA licensed medicine, that may interact with a range of prescription medications by affecting how your liver processes drugs. The interactions of most concern involve diabetes medications, anticoagulants, statins, and immunosuppressants. And the most important thing you can do is talk to your GP or pharmacist before starting it. Have you ever asked your doctor about a supplement before taking it? Let us know in the comments. We'd love to hear your experience. And if you found this helpful, please give it a like and subscribe to the Bolt Pharmacy channel for more evidence-based health information.